Hi, I'm Myles Suehiro. I was trained formally as an interventional pulmonologist, and what that means is I spent a lot of time in the operating room doing procedures, in the ICU, taking care of very sick people. And during this time, I had a perspective about what medicine was like. I was seeing elderly people who would get a simple pneumonia, and then from this pneumonia, from a flu, would start developing pus in the chest, we call empyema. And so I would have to go into the chest, clear that out, and I would ask, why are these people getting so ill? There are a lot of them. And so I never could quite explain this. And so there were no underlying predisposing diseases. They weren't debilitated. Otherwise, they were relatively healthy. But there were plantation people, had very simple lives, and they ate fairly simple. And so I started looking at their diet. And so I said, gee, you know, I don't see a lot of fresh vegetables here. I don't see a lot of sources for vitamins and bioflavonoids. And I thought this might be important. And so this was, again, repeated over and over. I used to see this in some of these patients. I used to see this also in severe asthma cases. And so I started working a little bit more with their diets. And this goes back some 25 years ago. And I started to clue into this because years ago, I had one patient ask me, what was bioflavonoids? And this is before the days of computers. And I said, I don't know. And so it took me a while to get the answer. And then I found out that these were the colored components of vegetables that had anti-inflammatory effects. They were antioxidants. And so this is how I got sensitized to this whole area. And so as I started working with these patients, I started asking more about their diets. I started to see there was a pattern to this. And so I started to introduce more supplements, vitamin supplements, better diets, more salads. This is where A4M showed me that there are other dimensions to diseases. And so this also kind of emphasized this point about diagnosis and treatments, labels and therapeutic regimens. In other words, once you go through the analysis and then you come down with a box, you get in that box, and that box kind of like stays with you as a label. And so all these patients would come back as labels. And so I was seeing a bunch of asthmatics. I'm asthmatic myself, and so I have a good feel for asthma. What I was seeing was that I was getting a lot of referrals for asthma. They were severe asthma. They did have asthma. They were getting sick from asthma, but that was not the main reason why they were having most of their problem. They were having shortness of breath, wheezing, debilitation, frequent hospital admissions. But underlying these conditions were things like heart disease. They had mitral stenosis, aortic stenosis, heart failure. And so this is where I began to see there are other mechanisms underlying a lot of these symptoms. And so this is what, again, sensitized me to this concept, that we have to focus, instead of on labels and boxes, we have to focus on the underlying mechanism. Now, along with this came the concept of sleep apnea. I tried to volunteer for the Indian Health Service working with Native Americans, and I was told that 25% of them had obstructive sleep apnea. And so one of the pediatricians came up to me and says, oh, we're glad you're here. You can help us with a lot of the kids. I said, how come? He says, 25% of the Indian kids have sleep apnea. I said, really? How do you pick them up? He said, oh, poor school performance. And we do a sleep study, and they're positive for sleep apnea. What that means is that they block down and they stop breathing, the oxygen drops. That affects their mental function and affects their school performance. So I said, oh, wow. What do you guys do? He said, oh, we take out the tonsils. I said, oh, tonsils infected? He says, no. Are they swollen? No. I said, why do you take them out? Oh, because we have to make room for the swelling in the back. I said, wow. So you take out normal tonsils to make room for the diseased tissue in the back? He says, yeah. I said, well, that's not quite the way I look at things, but anyway, let me look into this. And lo and behold, there is a lot of inflammation and swelling in the back of the throat that causes the blockage to occur much easier when they go to sleep. And so this is where I started to look for reasons. Why is this occurring? Again, a focus on process rather than on diagnosis. Now, another thing happened. My sons are aerospace engineers, and they kind of introduced this idea of a systems engineering, which was using all the different forms of engineering and working them together and overseeing them as a whole system. And so this is where I said, I would like to develop a systems approach to medicine, or systems medicine. This is an emphasis on the evolving assessment of a process rather than getting stuck with labels, rather than getting stuck with the same diagnoses from episode to episode and not being able to move out of that box. So again, this is why I'm emphasizing this concept about a systems approach, looking at the underlying mechanism, and in these cases, both with asthma, sleep apnea, allergic rhinitis, sinusitis, what underlies all of these, even underlying the empyema, was the inflammatory reaction that occurs. And this is where the metabolic syndrome, that little bit of obesity, causes hormonal imbalance, inflammatory changes, metabolic changes. And so my approach would be to try to assess this metabolic, hormonal imbalance with sophisticated laboratory testing, identify problems early, and then try to intervene with, again, lifestyle changes. Simple, natural approaches first: diet, exercise, good sleep cycles, and then intervene if possible with medication. We can't do without medication, especially if someone is acutely ill. As I've already discussed, in the ICU, in the operating room, sometimes we do need to have very strong intervention. However, to make sure that these problems don't recur or keep recurring, we do need to try to stabilize that imbalance by finding very subtle imbalances in metabolism, hormones, diet, and then try to get a good, flexible balance and adaptability of the patient. If you would like to know a little bit more about my approach to medicine and medical problems, you can contact me on my website, and all my contact information will be there.